I'm with Experimental Station. We're a not-for-profit on the south side and in a disadvantaged neighborhood. One of our programs is a statewide program that we call Link Up Illinois. And Link Up Illinois provides funding and training to farmers markets and some grocery stores now across the state. We're at about 150 different locations across the state. And what we enable these locations to do is to provide link match. It's what we call link match. And so it helps SNAP recipients to be able to double or to match the value of their purchases for the purchase of fresh fruits and vegetables. So, many of these markets and grocery stores are located in rural areas and disadvantaged urban areas. In the last year, we had about $1.47, almost $1.5 million of fresh fruits and vegetables purchased by SNAP recipients using Link Match. So it is a very utilized program and a very important part of their, increasingly important part of their diet. But we know that when money is tight and when SNAP benefits are reduced, the very first thing that disappears from the grocery list is fruits and vegetables, as folks are trying to feed the family for a month. Even if SNAP recipients would like to buy them with reduced benefits, they will have less matching power to do so. We also know, as Elaine mentioned, that lack of healthy foods like fresh fruits and vegetables in the diet will also increase a host of diet-related diseases. Now, I want to give you just one little bit of data from the surveys that we do of SNAP customers at farmers markets across the state. We do it each year. And this last year, 77, and this is important to me, 77.5% of the SNAP recipients who filled out that survey stated that their health had improved as a result of using Link Match. 77.5%. 43% said that their health had improved greatly as a result of that. And what that means is as a result of eating more fresh fruits and vegetables. And if you reduce the amount of SNAP, it reduces the amount of matching power that they might have to actually purchase fresh fruits and vegetables. And when I think about this, I think, what does that mean in the bigger picture? And given that many SNAP recipients also qualify for Medicaid, as we mentioned, by supporting their health, we the people save money. It is more likely that if you're suffering from a diet-related disease, you are less likely to go to work consistently. If you have better health, you are more likely to go to work consistently. You are more likely to contribute to productivity. You are more likely to be promoted. In that case, you are more likely to, have your salary or your wages increased. You will then also pay more taxes. You're contributing in a whole bunch of different ways. And what we have come to believe over the years is that access to affordable, healthy food is the foundation for building wealth in disadvantaged communities. It is truly the foundation for building wealth. And if you reduce those SNAP benefits or get rid of those SNAP benefits, those health changes, those health improvements are going to disappear or they will not continue. In regard to the impact that this has also in terms of farmers and farmers markets, when you cut these benefits, this will affect the local economy, and the economy will suffer. When it comes to farmers markets in rural and urban settings, those SNAP dollars and the Link Match dollars that we provide, they go directly into the pockets of our local farmers and producers. They don't just evaporate into thin air. So as SNAP recipients, SNAP users are spending their dollars at farmers markets, they're able to feed their families, but they are also feeding our local food system. They are also feeding our farm economies. And that is very, critical for the state of Illinois and for our rural economies.